Have you ever thought to yourself, I will start my practice when I take this next class, when I get this next certification? If I just take one more course, I will feel ready to start my own practice. If that's you, then this video is for you to watch. I've seen a lot, and I've done this myself too. Back before I started my own practice, I just felt like I needed more education. I needed to know more information in order to start working with patients on my own. And the long and short of it is that it's just not true. You leave school and go into the physical therapy field with a doctorate now, or you already have another degree, whether it's a bachelor's or a master's. But for everybody graduating now, you have a doctorate level degree. And in order to practice, you have to have a license. So you have those two things already. You already have letters after your name. And for some reason, when it comes to working for ourselves and practicing on our own, we tend to have this initial reaction that I need to take more courses and more continuing education and get more certifications in order to be qualified to work with patients on my own. Whereas we don't think that when we're applying for jobs to work for somebody else, but for some reason we feel that we have to do that if we're working for ourselves. You go into working into whether it's outpatient or inpatient, home health, working for somebody else with just your doctorate and just your license. And that's plenty good enough. It's good enough to get you hired. It's good enough to get you paid. It's good enough to help patients get better. But then when it comes to working for yourself, it's all of a sudden we pump the brakes and feel like we need more in order to still help people. And it's just not true. You have everything that you need in order to start seeing patients privately. And the thing is that you don't know everything and you never will. So if you spend, the next year taking 3 or 4 gigantic continuing education courses and getting more certifications because you think it will make you feel more ready, it won't. There will always be more questions and more information to learn. So if you are sitting here thinking should I start my business next or should I take another certification course? The answer is start the business. If you want to start a business and you want to start your practice and see your own clients, just get started doing that, because the classes are always going to be there. You can always go and take more classes. But if you don't start your practice, you're not going to be able to start to implement the information that you're getting from those classes with your own patients as quickly. My recommendation is to always start your business and then you can pursue more con ed as you're working with patients on your own. And part of this, and I think that some of us can go kind of a little bit education crazy when we are looking into different courses and certifications, because so many of us love to learn new things. We just love learning all the things, learning all the new research and treatment methods, and we love to be on top of our game. And when it comes to starting your own practice, in most cases, you are going to have to narrow down who you are trying to work with, what kind of population, what kind of injuries they typically have, and what kind of treatments you offer. You're going to have to narrow that down, especially as a single practice owner and clinician, because you won't be able to do it all. When we leave school, and I know my experience in outpatient ortho is that there's an expectation for you to know a little bit or more about a lot of different things and be ready to work with anybody at any time for any reason at all. And it makes it really hard. I know it was very overwhelming for me, and I felt like I wasn't really able to do my best work when everything was so scattered all the time. And I was working with so many different types of people on different diagnoses. And what I have found is that since I started my practice and I've been focusing in on fitness athletes, specifically in the CrossFit realm, and then also getting a little bit more into pelvic health for female athletes, I have been able to become a better clinician because I have focused all of my efforts in learning on those specific areas. So almost all of the continuing education courses that I take fall into one of those categories so that like my brain stays really focused on what it is that I'm trying to help people with, and I'm able to get a lot better, which leads to better results for my clients, which leads to, my practice and my business doing better as well, because I become the expert in the area versus trying to get certified and taking courses on all kinds of other things, whether it's like neuro stuff or ped stuff or geriatrics. Like I could take courses in those, but because that's not the specific focus of my practice, I choose not to, so that I can get better at the things that I am doing. And in a sense, this ends up helping me get past like the thinking of I need more courses in order to be better, because since I started my practice and narrowed my focus, I can narrow and focus my learning so that I am better when it comes to the practical aspect of things and actually working with clients, instead of trying to be like scattered everywhere and trying to guess what it is that I think people want from me. I am taking the information, the objective information from the actual people that I'm working with and looking to get better in those specific instances. So over time, things end up continuing to get better clinically and in the business. And I hope that makes sense. Another question that I do get asked and I see from a lot of people is like, how soon can I start my own practice as a new grad, or like how much clinical experience do I need in order to feel confident in doing this on my own? And I think it depends on a couple things. Like first, like disclaimer I will put out there is it's kind of like a dicey area to be in when we say, like, oh, once I have 2 years of experience, that'll be enough. Or once I have 5 years of experience, that'll be enough. Because very quickly you will reach that milestone, you'll reach the 2-year mark, and you still won't feel ready. Because surprise, you still don't know everything. Like I said, you never will. And you'll hit like 2 years, 5 years, 10 years. Like I've talked to other clinicians who are 10 years out of school and they've been practicing for that long, and they still are like, well, I don't really know if I have enough experience to work with patients on my own. And, it's crazy because like a decade of experience, it sounds like so much, but for some people it still doesn't feel like enough. And I think that at some point you just have to start to ask yourself, like, will there ever be enough? Like, will I ever reach a point where I can say, like, check, I have my clinical experience? Because I think in most cases you'll never really feel ready. You'll never feel like you've had enough clinical experience. And the best experience that I have had so far is like jumping right into the deep end with my niche, like with fitness athletes, and being willing to meet with people and, evaluate the patients. And whenever something comes up, specifically, like I had a TMJ patient one time, and even some of the pelvic health stuff when I was first learning about that, whenever something comes up where like clinically I am not super comfortable with it just because I don't know a ton about it, I am always upfront and honest with the patient and let them know that it's not my area of expertise. And if they would like, I'm happy to look into it for them and see what we can do. But if they prefer, I can always help them find somebody who maybe is more of an expert in the area. And every single time, my patient has been more than happy to try working with me for a few sessions and see what we can do. And they appreciate the honesty and the fact that you're willing to try for them, And so from that like process of taking things on that I don't have previous experience with, but using like real time practical application of research that I've done on the topic, on the diagnosis or, the problem, I've learned so much more than trying to like guess, I suppose, before the situation actually comes up. So, ask yourself, how much clinical experience do you feel like you need? For most people, they can't really come up with an answer. Even if they say, 2 or 5 years, they get to that point and they still don't feel like they're ready. So it's sort of not even worth trying to like wait that long, and if you really truly do want to start seeing patients on your own, you have the tools that you need to do so. because you are seeing patients on your own. You're just doing it for somebody else. And for us, all we have to do is create the infrastructure that we need in order to start seeing patients on our own for ourselves. Another thing that I do like to point out, though, is if you are getting into a niche where, you like it, you feel like you have experience, but you don't know everything, and you're just worried about running into different like clinical situations where things, might be a little bit beyond what you have knowledge on. Something that's super helpful is just creating professional connections with people in your area of expertise. So, like, I have professional connections with other physical therapists who work in the fitness athlete realm and in the pelvic health realm. And I have definitely, on multiple occasions, whenever I have kind of reached like a dead end clinically with somebody, I've reached out to those other therapists and said, like, hey, can I run a case by you? Because I'm really like stumped here and I need help. And people are so willing to help you. So whether you make those connections locally with other practices, which I think is a great idea, or you make connections online across the country and across the world, you'll always be able to find another clinician who's willing to talk things through with you and help you figure out what to do in order to best serve that patient. So like, I know some people are worried about working on their own because they think that they won't have that like opportunity to discuss clinical cases with other practitioners and get feedback, but you can always find other practitioners around you in your area who are willing to help you out and help you figure out what to do in order to best serve that client. And lastly, I think just kind of to wrap all of this up, a question that does come up sometimes that I think makes people worry, and get a little bit stressed out is, what if I start my practice and I start seeing private clients and somebody comes to me and I don't know how to help them? So whether it's like me and a patient that I had with TMJ issues, and I had never helped anybody with TMJ issues before, or it's somebody who's totally outside of your niche, you have a couple of choices. First of all, remember, like, nobody expects you to know everything. They're looking at you as a possible expert to help them with where they're at right now. And you are like totally welcome to let them know that you can't help them, that you're not the right fit to do so. And that's okay. Like, it's helpful to the patient because you can help guide them along in their journey to the next person who might be able to help them. So like, if somebody comes to you and they're outside of your niche, or you don't know how to treat them, like, you have a few choices. If they're just outside of your niche, but you can still help them, if you like them and it feels like a good fit, go for it. That's totally fine. If they come to you and they have like a diagnosis or problem going on that you aren't familiar with, you can tell them, I'm not familiar with this, but I can try and see if I can help you. Or you can refer them to somebody else. Like, it's like part of like the power of niching down is it helps to make it very clear for you what kind of patients to take on, because you can spend a lot of time getting really good in one specific niche. And then if people come to you that are outside of that and you don't feel comfy working with them, that's okay. And you can always refer them out to somebody else. Overall, I hope that this makes sense. Like, I want the takeaway here to be that if you are somebody who is wanting to start your own practice, you don't need more certifications or more continuing education or more courses in order to be good enough to start seeing patients on your own. You're seeing patients on your own right now, working for somebody else. The only thing that's changing really is the business entity. You are still the same therapist, the same healthcare provider who knows the same amount of stuff. It's just a different environment and a different situation. If you don't start trying to see patients on your own, you never will. So that like initial like launch time, it's probably going to be pretty bumpy as you're figuring things out with like the logistics of running a business and how to do your own marketing and how to sell your own services. But you have to practice and you have to try in order to get where you want to go with it. So let me know what you think down in the comments and what questions you have. I know this kind of got a little bit rambly as well, but I hope you can tell I'm super passionate about PTs starting their own practices, because there's so much of an impact that we can have on our patients and our community. And it's such an amazing opportunity to have for you professionally in your career to be able to like have true autonomy in the way that you're practicing. So highly recommend to everybody. And if you are somebody who is looking for help with this process, if you are somebody who likes to have external accountability, a step-by-step checklist of exactly what you need to do in order to start a business, please let me know. Schedule a free 15-minute consult with me, and you can find the link down below in the description. But we can talk about where you're at, what you are hoping to do, and if the way that I work with people, the way that I help PTs and other healthcare providers start practices is a good fit for you. But either way, I'm happy to help you take the next steps forward. So thanks for being here, and I'll see you on the next one.